Hello everyone, I'm Deepa Francis. I work at Armadale Health Service as a critical care trained RN. Today, I'm here to explain on intravenous cannulation procedure. Peripheral intravenous cannula allows the administration of fluids such as sodium chloride, plasmolite, gel infusion, and next to give or administer medication such as antibiotics or any other emergency medications. The third purpose of intravenous cannula is to administer blood and blood products, and finally the most important indication is to maintain an intravenous access to the patient. Now we are looking on to the veins for cannulation. The most common veins are metacarpal veins, cephalic vein, basilic vein, and median cubital veins. On the diagram we have the veins of the anterior forearm. The most easy accessible vein is the median cubital veins, which are large enough for an intravenous cannula. As a personal preference, I would go from the veins which are close to the wrist rather than puncturing the median cubital vein. Moving on to the indications of intravenous cannulation. The main indications are for the administration of blood products, for intravenous administration of medication, and also to maintain an intravenous access to the patient. Now I hope that you all are familiar with the indications of intravenous cannulation. Here are the contraindications of the procedure. The first one is the arm on the same side as mastectomy. In mastectomy patients, we often see the axillary lymph nodes removed or taken out. The main purpose of the lymph node is to help to drain the fluids and cells out of the arm. When a patient has lymph node removed, they have fewer drain pipe or fluid to move out of the arm. The second contraindication is on the arm with an atriovenous shunt or fistula. An AV fistula is commonly seen in patients who received regular dialysis. In such cases, we often omit the arm which has a fistula. The third contraindication is on the arm with edema or deep vein thrombosis. Till now I was explaining about the purpose, indication, contraindication of performing an intravenous cannulation procedure. Now we are going to see the articles or the equipment required for this procedure. The first one is the disposable gloves. The second one is safety glasses, an intravenous cannula, anti-reflex valve, tourniquet, basics dressing tray, scissors and tape, disposable razor, underpad, plastic waste bag, tegaderm, and alcoholic skin preparation. Apart from the other article, we need the sharp container to discard the sharps, Vacutainer attachment and pathology tubes if a routine blood collection is advised by the doctor, an IV pole or a pump for starting an IV hydration to the patient, and the least and the most important one is 10 ml normal saline ampoule and a 10 ml syringe. Moving on to the clinical procedure. As we all know, for each and every single procedure we have to explain it to the patient, obtain a verbal consent from them, and then we have to select the non-dominant arm of the patient. After selecting a particular non-dominant arm, we have to wear the safety glasses and go and perform hand hygiene. Once the hand wash is being done, we have to set up the dressing tray and select the cannula of appropriate size. The most commonly inserted cannula are the size number 20. In case of blood transfusion or where a patient needs more big access, we would prefer to have an 18 gauge cannula inserted. After setting up the dressing tray for the cannulation, take the tourniquet and apply it to the upper arm of the patient. Instruct the patient to open and close the fist to see the palpable veins bulging or popping up. After selecting a good vein, go and perform the hand hygiene. Then apply the disposable gloves and take out the cannula from the dressing tray and hold and rotate the barrel on to 360 degree. This is performed to know that the cannula is patent and in a working condition. After that, we should move on to the patient and prepare the skin for the cannulation procedure. After cleaning up, we have to wait for minimum of 45 seconds to dry up the preparation, alcoholic preparation which we have applied. After stabilizing the vein, insert cannula at 15 to 25 degree angle. Then advance the cannula and still it as a single unit till we identify the entry into the vein by a flashback. On flashback, we have to decrease the angle of the catheter and then advance stillet and the cannula into the vein. After the advancement of the needle and the cannula into the vein, hold the half of the needle and slide the catheter into the vein. Then press the button on the cannula to retract the stillet. After doing that, we can release the tourniquet on the arm of the patient. Then apply a digital pressure beyond the catheter tip and stabilize the cannula up. Dispose the stillet onto the sharps container. After discarding the stillet, attach the reflex valve and secure the cannula by applying a tegaderm. To maintain the patency, flush with 5 ml of normal saline and secure the rest part of the cannula. Leave the patient clean, dry and comfortable after finishing the procedure. Dispose then all the appropriate waste onto the correct bins and perform the hand hygiene at the end of the procedure. Lastly, we should know the complication of intravenous cannulation. The complications are listed here. The first one is infection, which means for every procedure there is a chance of infection. Similarly with intravenous cannulation also. The second complication is phlebitis, which means inflammation to the veins. which can be caused by unhygienic procedure. So as nurses we should perform hand hygiene before and after the procedure. Third and fourth complications are emboli and the thrombus, which in other words are the clot formation in the veins. The other one is the pain, and the last two complications are extravasation due to inserting the cannula other than to the vein, and hematoma caused by pooling of the blood. I hope you understood my procedure, indications, contraindications, as well as the complications of performing intravenous cannulation. Thank you for spending your valuable time with me.